Welcome to today's video. In today's video, I am going to have a look at one of the complications of hypertension. The last video that I made, I talked about stroke as a complication of hypertension. So today, I am going to look at preeclampsia and eclampsia as a complication of long-standing chronic hypertension. Alright, so before I proceed, let's have a look at what preeclampsia is. Preeclampsia is the development of hypertension and significant proteinuria in pregnancy after 20 weeks of gestation in a patient who previously was not hypertensive and non-proteinuric. Okay, in simple terms, what I'm trying to say here is that if a woman is pregnant and that woman was not hypertensive, but after 20 weeks of pregnancy the woman develops hypertension and also protein. If the urine of the woman is collected and tested, if significant protein is seen in that urine, that patient is having preeclampsia. Now, eclampsia, on the other hand, is when there is hypertension and significant proteinuria plus the development of seizures in the absence of neurologic disorders. Okay, before a patient can be said to have eclampsia, seizure disorders such as epilepsy must be ruled out. Also, metabolic derangement, metabolic disorders should be ruled out. So let's look at the risk factors, because I was saying that this preeclampsia and eclampsia can be as a result of chronic hypertension. So let's look at the risk factors. What are the things that can make somebody have this preeclampsia and eclampsia? There are risk factors. One of the risk factors that somebody may have is, of course, chronic hypertension. Another risk factor is when a patient have had kidney disease or the patient has autoimmune disorders. Okay, if a patient has had kidney disorders or autoimmune disorders, or somebody has had chronic hypertension, or other risk factors like advanced maternal age, that is, if the woman is more than 35 years or is 35 years old, there's high risk, high chances of developing preeclampsia and eclampsia. Of course, if the patient has a high body mass index up to 30, okay, so body mass index of 30 is a high risk factor. Yesterday I talked about body mass index, so today let me have a recap of what body mass index is. Body mass index is the ratio of the weight of a person in kilograms to the height of the person in meters squared. So, like I said, if the person's body mass index is 18.5 to 24.9, that is normal. But anything above that, that is 25 to 29.9, that would be overweight. But a patient that has from 30 is obese. Okay, so if a patient's body mass index is 30 and above, there is a high chances of that person having preeclampsia or eclampsia during pregnancy. So, what is the cause? Many times, patients that I've seen, relative will ask me, doctor, what is the cause of this person having this problem? Why is it happening? What is causing this preeclampsia that you are talking about? Well, the etiology is not fully understood as at this moment. However, there are postulations to why somebody may have preeclampsia. One of the postulations is the uterine placental spiral arterioles insufficiency. What this means is that there are blood vessels that supply the placenta and the uterus. So because of this insufficiency, there would be insufficient uteroplacental blood flow. Okay, this might be the reason why some people may have preeclampsia, and of course, what is called ischemia may also explain why some people may have this preeclampsia. So that is by way we can say, okay, this might be the reason, but of course it is not fully known why these things are happening. So let's just look at what would be the defining factors. How can you say somebody has preeclampsia? What is the blood pressure that you are going to check and say, okay, this person has preeclampsia? So the blood pressure to be measured is, if the person has systolic blood pressure greater than or equals to 140 millimeters of mercury, and or diastolic blood pressure of greater than or equals to 90 millimeters of mercury, and significant proteinuria, which is 300 milligrams of protein in 24 hours during collection, that person is said to have preeclampsia, and this should not be for so the patient goes to the hospital and sees the doctor, who detects that the blood pressure after 28 weeks of gestation is either 140 systolic or more, and the diastolic either 90 or more, and the patient urine sample is collected and is shown to have 300 milligrams of proteins in 24 hours during collection. So the doctor can diagnose preeclampsia. And most so, there is what is called mild to moderate preeclampsia and severe preeclampsia. The first one that I talked about, the blood pressure, that is mild to moderate. Then severe preeclampsia is when systolic blood pressure is 160 or above. Diastolic blood pressure 110 or above. Now, apart from urine collection, if during a dipstick test of the urine 2 pluses are found, that can be an estimation of significant proteinuria. So 2 pluses or more. And of course, in the early morning urine sample, the patient might be said to have preeclampsia. Now, it is important to differentiate between preeclampsia and chronic hypertension in pregnancy. In preeclampsia, hypertension will not develop before 20 weeks of gestation. But in chronic hypertension in pregnancy, the patient was already hypertensive, and this is seen before 20 weeks of gestation. Okay, so that's the difference. The person that is having preeclampsia, in which blood pressure or hypertension has developed after 20 weeks, should have her blood pressure return to normal after 6 weeks of gestation, normally 12 weeks. So by 6 weeks after delivery, the blood pressure will return to normal, but it can stay up to 12 weeks. If it's still resolved after 12 weeks, that was preeclampsia. Alright, so what would be the clinical presentation if somebody has preeclampsia or eclampsia? The patient may have headache. Pregnant woman coming down with headache, visual blurring, chest pain or right upper quadrant pains. That is where the liver is. So, and of course, nausea and vomiting. If investigation is done in the lab, there may be abnormalities in blood clotting, that is, abnormal clotting profiles. The person may have raised liver enzyme, and the renal function test will be deranged. Liver function like transaminases, those enzymes will be raised. Platelets may be low, or low platelets is seen. That is why this patient may bleed, have tendency to bleed because of platelet abnormalities. Okay, they may also have decreased urinary output. So those are some of the things that may be seen. And of course, one important clinical features that may be seen is when this patient develops non-dependent edema. Edema may be in the upper limbs and the face. Unlike the lower limbs, they may develop non-dependent edema. If a woman has edema, pedal edema in pregnancy, it is said to be normal. But when the edema becomes when the progress is very rapid, it may suggest what is called HELP syndrome, wherein there is hemolysis, elevated liver enzymes, and low platelets. So, what should be done if a woman has this complication? What should be done? Well, the woman, anybody that has this kind of medical condition, should go to the hospital and see their gynecologist. The blood pressure would be controlled. The doctor knows the right medication that will be used to control the BP, so that the patient will not even come down with more serious complication, which is eclampsia. And if the patient is towards the time of delivery, there are so many things that the doctor will do depending on the assessment to know whether the patient can deliver, or that is, whether the patient can deliver normally through the birth canal, or whether intervention would be done. All these would depend on the clinical assessment of the doctor. So, preeclampsia is one of the complications of chronic hypertension. Although people that have preeclampsia may develop hypertension during pregnancy, but one of the risk factors of developing preeclampsia is chronic hypertension. Other risk factors like having preeclampsia before. If somebody had had preeclampsia in the previous pregnancy, the person may have preeclampsia again. And most importantly, if somebody is carrying twins or other higher multiples, that is multi-fetal gestation, the risk of developing preeclampsia is there. Now let me clear some doubt here. A lot of times people think that having preeclampsia is caused by spirits, or it's caused by attack. Some people are attacking. No, there's nothing like somebody attacking. There's nothing like spirit. The reason why a pregnant woman has this sometimes seizures during pregnancy is as a result of preeclampsia, which I have defined. May not be spiritual attack. And of course, before any doctor can say this is preeclampsia, they would rule out, they would ensure that this person was not already epileptic, did not used to have seizure disorders, and of course, metabolic disorders. And one of the complications there is also if somebody is diabetic, whether it's diabetic type 1 or type 2 diabetes. So these are the people that can come down with preeclampsia. So that is all that I have to say about preeclampsia and of course eclampsia. The difference between the two is that in preeclampsia there is elevation of BP and significant proteinuria, but when seizures develop in addition to this, that means the patient is having eclampsia. Many times we've seen these cases. It is something that could be managed, and one thing that should be emphasized is that pregnant women should try and attain their antenatal, because most of the cases I've seen that resulted in fatality were patients that were not seen in the hospital. They were not seen by clinicians, they were not seen by obstetricians. They were being managed by traditional birth attendants, And traditional medicine, don't try to manage this kind of cases because it's not something that you can manage. If you have such a case, tell them to go to the hospital and see qualified medical practitioner that can do the right thing for them. So please, that is where we are going to call it a day. Today we're looking at one of the complications of hypertension. Yesterday we talked about stroke. God willing, in subsequent video I will also bring another complication of hypertension. But all of this is to let us know the risks of hypertension. I said in my video, one of my videos, that hypertension is a silent killer. There are people that would have preeclampsia and they will not go to the clinic. They will not even have their BP checked, and that is dangerous. If you are a husband and you are watching this video, please encourage your wife who is pregnant to have good antenatal care. And if you are a woman, you are listening to this video, always ensure that when you are pregnant, you are seen by a qualified, trained medical expert, so that if anything wants to happen, they will know what to do. And of course, if you are a woman above the age of 35, or you are 35 and you are pregnant, that's not the time for you to be going to see a TBA because of these risks that we've mentioned. Or you've been pregnant and the interval of your pregnancy is up to 10 years. You may be at risk of developing preeclampsia or eclampsia. Or you are having diabetes type 1 or type 2, or you are carrying multiple fetal gestation, that's multiple pregnancy like twins, triplet, or other higher multiples. You may be at risk. So why not take advantage of good obstetric care by experts? Please share this video. It's very important. Share this video so that others may see, and also make use of this quality information that we are churning out. Share, like, subscribe. Please follow my page. Thank you very much, and remain blessed till I come your way next time.